The information contained in this program is based on the works by Dr. Robert C. Atkins and is the result of over 30 years of medical practice as the head of the prestigious Atkins Center in New York, where he is still in practice. If you are suffering from a medical condition, please consult your doctor before starting this program. Many dramatic changes can occur in a short time, and if you or someone you love is on medication, your physician should be made aware of your progress. Although you can lose weight quickly on this program, we suggest that you set safe, realistic goals for your weight loss. Losing weight too quickly can of itself be unhealthy. Review the materials. You will pick up new pieces of information the second and third time you review the material that you may have missed the first time, especially in the rare case that you encounter difficulty. When you fully understand how simple and easy this method is, you will have new, stable dietary laws that will make and keep you at your goal weight forever. A worthwhile endeavor.
Welcome back. Now it's time to get started on personalizing the diet. Imagine that you're my patient and this is your chart, and that we're now talking about how the diet, the program, is going to work for you, how it's going to be individualized for you. In the first place, I promise you that no matter which level of the diet we end up with, that you're going to lose weight without being hungry and with a remarkable sense of being satisfied, that you're going to eat foods that you thought shouldn't even be on a diet. In fact, they're going to be the mainstay of this new diet program that you're going to be on. And you're going to have many chances to make this diet more delicious than it would be otherwise, because you're going to have recipes, you're going to have ways of making that food so delicious that it won't seem like a diet. You're not going to be counting calories. You're not even going to be restricting your quantity. You're not going to be hungry. You simply are not even allowed to be hungry. And all I want you to do is some of the simple things that I'm going to be teaching you. I'm going to teach you how to change your diet without cutting the quantities of the diet, without cutting the quality of the diet, just leaving out certain ingredients which just happen to be the ones that we're putting weight on. And when you cut them out, you won't miss them, at least not after a day or two, when you realize that this is different from what you've been doing before. This is not a sufferer's diet. This is a very pleasant experience.
I loved it. I couldn't believe it. My wife said, "We're going on this diet." I said, "Oh, brother, now what? Another one?" So we started on the diet. Hey, this ain't bad. Boy, I was eating eggs. I love eggs. Omelets, eggs, upside down, any way you want. Sausage, bacon.
We went on the diet, and like I said, the first day I lost 2 pounds, and it just kept falling off. The first 2 weeks of induction, I could almost do nothing and watch the weight just drop off.
I lost approximately 25 pounds on the diet. I was surprised that it went so fast, because I've never lost so much weight in my life. It was just incredible.
It's so easy to follow this diet that to me it's not being on a diet at all.
This is how low you can go. It's incredibly exhilarating to have lost 4.5 inches in 1 week, and I don't even think it's been a week. It's been 6 days, so that's even better. And I never expected it. It's absolutely amazing. And if you want to do it, you want to have this same kind of feeling that I do, because I'm about to cry. She is. She's gonna cry. It is really cool. And you really need to go for it.
Before we go any further, let's make a commitment. Let's make sure we're on the same page and that you're on board with us. So in case you have any doubts and don't think that you want to try it, this would be the time to drop out and not get started. So make your decision now whether you're on board with us. As a matter of fact, I'll wait. Now, as a matter of fact, I think that you'd be crazy not to get started. So I'm going to assume that you're on board. And so now that we're on the same page, we're on the same wavelength, let's get started.
The following instructions will help you understand the basics and get you started right away. To fully understand this material, please try to watch this video in a distraction-free environment. Get a pencil and your product components. This will come in handy as we go along.
Okay, we're getting started now. We're going to start off by getting the basic diet manual. Get that because there's a questionnaire there, which is exactly the same one that my patients fill out at the Atkins Center. So I'm going to have the same information, and you're going to have the same information that I have when I see a patient. Okay, let's look at that basic diet manual. You'll see a lot of things. There are questions about your waist to hip ratio and your weight and how long you've been overweight, and all sorts of questions about the problem itself. But you'll also see that there is a diet questionnaire for you to fill out about what you eat. I'd like to focus on that right now. You're to fill out not only what you usually eat, but also what you eat under exceptional cases. Sure, you have this one breakfast on Monday, Tuesday, and Wednesday, but what do you do on the weekends? And then what about what do you put in your mouth that's not at mealtime? Things that are called snacks. What about the things that you don't want to eat and are embarrassed to eat, but get them in your mouth somehow? They should be written down. And what about your beverages? It's not always just water. Sometimes these beverages are very important. So now you are going to have a list that is absolutely honest. There's no point in exaggerating one way or the other because this is the old you. It's not the new you. The old you must have made mistakes, and let's find out what they are.
Fill out your diet questionnaire honestly. Be honest and thorough. I want a true life assessment. Don't worry if you don't like your answers. Everything will change for the better. I've seen it time and time again. Restart the tape when you are done.
Okay, now that you've completed that, let's analyze this diet for carbohydrate. A lot of people don't know what carbohydrates are. For instance, do you think your vegetables are carbohydrates? Well, they are. Do you think your frozen yogurt is carbohydrate? Not only is, but it's absolutely loaded. What about your juices? Very high in carbohydrate. What about a cracker, a Melba toast? Very high in carbohydrate. Are you beginning to get the picture? Maybe you know now that it isn't you, it isn't that you're a glutton, it's just that you didn't know how much carbohydrate you'd been snookered into. But now you'll see it, and you'll have a chance to go to a carbohydrate gram counter and actually analyze what your carbohydrate intake is. It might just blow your mind to know how many grams you're eating a day, particularly when the new you comes in with a considerably lower number. This can be the most revealing bit of information you will ever get. To see that you're thriving in the very near future on 20 or 30 grams of carbohydrate, and that without even knowing it, you were eating close to 200 or more grams of carbohydrate, thinking you were doing what was right. Now, you've listed all your foods.
Using your carbohydrate counter, tabulate the approximate number of carbohydrates you are currently eating. Don't be afraid of your answer. Just write down as best you can the approximate amounts you are currently eating. We're going to be cutting this area of your diet down.
Okay, now you have added up your carbohydrate. I wonder if you're a little bit surprised how many grams of carbohydrate you've consumed. I wouldn't be surprised if over 60% of your calories turned out to be carbohydrate. That might explain why you're suffering from being overweight, why you may have mood swings or cravings or fatigue or brain fog or trouble concentrating or a variety of other things which you just thought were you. Well, they're not you. They're just you when you eat that many carbohydrates.
You are free to eat as much as you like of protein foods, but we are going to restrict carbohydrates. Carbohydrates from rice, bread, potatoes, chips, once in your body, basically turn into a form of sugar. This causes a dramatic rise in insulin to push the sugar out of the bloodstream. Insulin is the fattening hormone. The rise and fall of blood sugar is what makes you tired and hungry all the time. That and the accompanied rise and fall of insulin are what can also cause a variety of insulin-related health problems. But we're going to fix that.
Okay, now it's time we describe what's bad about all that carbohydrate. Maybe you heard what they say about Chinese food. You fill yourself in a Chinese restaurant and then an hour later you're hungry. What does that actually mean? What it means is Chinese food was a high carbohydrate meal. But how many times have you been hungry after your breakfast or after your lunch and it wasn't Chinese? It was high carbohydrate. What's the lesson? Carbohydrates stimulate your appetite. On the downslope of your blood sugar, first it raises your blood sugar and you feel pretty satiated. But because you have an insulin disorder, it doesn't take long before your sugar starts down rapidly, crashing down. And as your blood sugar falls, you get hungry. That's the Chinese restaurant syndrome. That's the high carbohydrate diet syndrome. Now you're beginning to get some insight as to why you had your eating misbehavior that you were so upset with. It wasn't that you're a bad person. It's simply that your blood sugar was dropping so rapidly that you were getting hungry. Okay, what do we do about it? Well, here's what we do about it. We will, in just a few moments, change your diet to one without carbohydrates. You'll have salad, that much carbohydrate, and then you'll have a main course, steak or chops or chicken or fish. You'll have that sort of food, and you will see the difference. We'll go into greater detail about the food that you eat in just a few moments. Right now, I'd like to focus on just how much carbohydrate you may be taking in. Carbohydrate is a chemical that contains glucose. Glucose is the fuel that comes from carbohydrate. And it's a sugar. It comes from sugars to begin with, but it can come from starch because a molecule of starch, the sort of thing that's in a potato, is just a bunch of glucose molecules which are broken down by the enzymes in your body into glucose, sugar again. Let's take a look at just what these sugar equivalents are in the various foods that you may be eating.
What I'm going to show you is that your body turns carbohydrate food into sugar. Let's start with a typical breakfast of cereal, toast, orange juice, and a banana. Cereal has about 1/4 cup of sugar. Toast has about 1/4 cup of sugar. Orange juice has about 1/4 cup of sugar. Banana has about 1/8 cup of sugar, and that's just breakfast. Let's say around 10 a.m. you get hungry, so you have a snack. Let's say you have a fruit on the bottom yogurt. This fruit on the bottom, low-fat yogurt, has a whopping 1/4 cup of sugar. And for lunch, let's say you're watching your weight, so you have a skinned chicken breast, baked potato, and some bread. There is no sugar in the chicken, but the potato has a heaping 1/4 cup of sugar in it. And the bread also has a 1/4 cup of sugar in it. So now 3 o'clock rolls around and you're feeling a bit tired, so you have a few pieces of candy and a soda pop. The candy is about 1/4 cup of, you got it right, sugar. And the soda is about 1/4 cup of sugar as well. Now for dinner, you're a good low-fat dieter and you're really trying to do the right thing, so all you eat is pasta. Pasta, bread, and a soda. In the pasta again is about 1/4 cup of sugar. The bread, another 1/4 cup. And the soda, about 1/4 cup of sugar. Now are you getting the picture? Look at all this sugar in the foods you're eating. Incredible, isn't it? Keep in mind now that these spikes of sugar demand a spike in insulin to push all this sugar out of your bloodstream. Now that's just 1 day's worth. Multiply that by 365 days, and then by how old you are, and you should be getting the picture of why most of us have had such a hard time losing weight and why many of us suffer from such a variety of health ailments.
I guess you're ready to start doing it now, and we can. First of all, I want you to get the Meal Planner book, which contains some special recipes as well. I want you to pick out all of the foods that are listed there that are designed to get you into ketosis. Ketosis, by the way, simply means burning your own stored fat. Obviously, that's the first thing that you'd like to accomplish. And so pick out all of the foods that do that and make your decision which of those would be your favorite foods. Which are the ones that would make a nice meal plan for you, make you happy eating what you like to eat. In other words, if it says lamb chops and you don't like lamb chops and would rather have a steak, fine. If it says duck and you'd rather have chicken, fine. So on. Make those choices. There's only one thing I would ask you to do. Don't hit upon the same food day after day. Try to get a variety, at least a rotation of waiting 4 days before you go back to the same food. 2 reasons for that. One is that there can be food intolerances developed if people eat the same food over and over. As a matter of fact, that may be something you've been suffering with regard to wheat and things that you do eat over and over. Very important point. Secondly, even more important, is it's nice to have a nice variety of foods. We're here to enjoy eating. Isn't it wonderful? We're here to lose weight, but we're also here to enjoy eating. The best way to do that is to have the widest variety of foods that will get the job done that you can possibly imagine. So let's do that now. The objective is to get into ketosis. And may I remind you that what ketosis is? It's that delightful condition, meaning that your fat is serving as your primary fuel for energy. Perfect combination. People have said things about ketosis that simply aren't true. This is a dieter's delight. And you'll know the benefit. It is so dramatic. You're not hungry. All the cravings that you had before aren't there. You put more on your plate than you're able to finish. All of this is the benefit of ketosis, and you know it's there even if you're not in ketosis. You also know it by the fact that your energy is never fails. It stays up. All of this is beneficial. That's the principle behind the Atkins program, and that's the principle you're learning. You'll be able to use that the rest of your life. And you will not only enjoy eating, but you'll enjoy very good health. So, enjoy.
Doesn't this look delicious? As hard as this may seem to believe, these are the core foods that you will be eating on my program. A literal banquet of food. Enjoy.
Now, doesn't that look delicious?
You're now in the maximum fat burning phase. 20 grams of carbs a day is your limit. Eat until you are full, not stuffed. Eat only the Atkins approved foods listed in your manual. The maximum fat burning diet outlined here will shift your body into a metabolic state in which you will safely burn more excess body fat faster than you ever thought possible. To move to your ultimate weight, you may choose to stay on this phase of the Atkins diet as described for more than 2 weeks. This is safe to do. To continue to lose weight more slowly, but with more variety, and to establish a healthy lifetime eating plan, please consult the Basic Diet Manual. Enjoy.
This is how low you can go. It's incredibly exhilarating to have lost 4.5 inches in 1 week, and I don't even think it's been a week. It's been 6 days, so that's even better. And I never expected it. It's absolutely amazing.